Stop what you are doing. Look at your fingernails. Right now, before this sentence ends. Most people see 10 small surfaces they occasionally clean or trim. I see something entirely different. I see a printed report, a slow-motion record your body has been producing, one microscopic layer at a time, for the last 6 months. Every change in color, every groove, every shift in shape. Your body wrote all of it down. It has been waiting for someone to read it. Dorothy was 71 years old, a retired librarian from Nashville, Tennessee. She came to see me not about her nails. She came about fatigue. She was tired in a way that coffee no longer touched. She had seen 2 physicians in the past year. Both ordered blood work. Both told her the numbers were acceptable. Both sent her home. When I looked at Dorothy's hands, I saw something neither of those physicians had documented. The nails on her index and middle fingers were curved, not flat, not gently arched but domed, rounded over the fingertip like the glass face of an old watch. The fingertips themselves were slightly thickened, club-shaped. I referred her to pulmonology that same afternoon. The CT scan found a small adenocarcinoma, a form of lung cancer, in the lower lobe of her right lung. Stage 1. Surgically resectable. She is alive today. She had no cough, no chest pain, no weight loss, no symptom that either physician had found meaningful enough to pursue. Her nails had been sending the signal for months. Nobody looked. I am going to teach you how to look. My name is Dr. Chandler. I specialize in gerontology and age-related disease prevention, specifically the early physical signs that aging bodies produce long before standard diagnostic tests catch what is developing. Your nail plate is built from keratin, the same structural protein as your hair, but the architecture is entirely different. In a nail, keratin fibers are compressed into stacked layers bonded by sulfur bridges that give the plate its hardness. That matrix of tissue at the base of your finger, tucked just beneath the cuticle, is exquisitely sensitive to every metabolic shift, every nutritional imbalance, and every inflammatory process occurring in your body. When those processes alter the matrix, the change is encoded into the next layer of keratin it produces. Think of your nail the way a geologist reads a rock core sample. Each layer carries a precise record of the conditions that existed when it formed. A full nail grows out in 4 to 6 months. That means right now on your hands, you are holding a 6-month archive of your body's internal state. A comprehensive review published in the Journal of the American Academy of Dermatology cataloged over 40 systemic diseases that produce identifiable specific nail changes, including cardiovascular disease, thyroid dysfunction, pulmonary conditions, hepatic failure, and autoimmune disorders. The authors concluded that structured nail examination should be a standard component of clinical assessment in adults over 60, noting that nail findings frequently precede laboratory abnormalities by weeks to months. Stay with me through to the end, because the 6th signal I am going to show you is the one that most consistently surprises my patients. And it is the one most likely to be visible on your hands right now without you having any idea what it means. Here is the clinical reality that standard medicine does not have time to explain in a 12-minute appointment. After 60, your body's internal reporting system becomes simultaneously more important and less legible. More important because the conditions that can develop, cardiovascular disease, thyroid dysfunction, early-stage malignancies, autoimmune processes, carry far greater consequence the later they are found. Less legible because the classical symptoms that alert younger patients often appear later, more subtly or not at all in older adults. A 40-year-old developing iron deficiency feels it within weeks: fatigue, breathlessness, pallor. A 68-year-old often adapts gradually, recalibrating their energy expectations downward, attributing the change to age rather than a correctable deficiency. The symptom is present. The interpretation is wrong. Nail changes are different. They are not subjective. They do not depend on how you feel that day or how well you slept. They are structural records, visible, photographable, comparable month to month. And they frequently appear before the condition has progressed to a stage where symptoms emerge. In the next section, I am going to walk you through 6 specific changes. For each one, I will tell you exactly what it looks like, what biological mechanism produces it, and, critically, whether it belongs in the observe, monitor, or act today category. Those three levels matter. They are not interchangeable. Observe means photograph it monthly, note any change, no immediate action required. Monitor means mention it at your next scheduled appointment and bring your photos. Act today means call your physician or dermatologist today. Do not wait for a scheduled visit. Signal number 1, the domed nail and when your fingertip changes shape. Place your hand flat on a surface and look at your fingers from the side. A healthy nail has a gentle, shallow outward arc, like a very slight hill. Now look for something different. A nail that is excessively rounded, domed, curving over the fingertip the way a snow globe curves over its base. And look at the fingertip itself. Is it slightly thickened? Wider than the rest of the finger? This combination, domed nail plus thickened fingertip, is called digital clubbing. Hippocrates described it over 2,400 years ago. It remains one of the most clinically significant findings in all of physical examination. The mechanism: in certain pulmonary and cardiac conditions, the body releases vascular growth factors, specifically platelet-derived growth factor, that stimulate capillary expansion and connective tissue proliferation in the fingertip. The soft tissue at the very tip of the finger literally grows. The nail, following the contour of the tissue beneath it, curves with it. The process is slow, months, which is exactly why it often goes unnoticed by the person living in that body. A systematic review in The Lancet found that digital clubbing is present in 29 to 35% of confirmed lung cancer cases, making it the most common perneoplastic nail sign in oncology. It is also associated with pulmonary fibrosis, bronchiectasis, congenital cardiac defects, and hepatic cirrhosis. Critically, the review documented cases where clubbing preceded radiological findings by 4 to 12 weeks, making it a genuine early warning signal rather than a late-stage finding. Self-test, the Shamroth window test, takes 3 seconds. Press the nails of the same finger on both hands together. Nail surface to nail surface, fingertip to fingertip. Look at the junction where the two nail bases meet. In a person with normal nail curvature, a small diamond-shaped gap of light appears between the two nail bases. You can see through it. If that gap is absent, if the nails press together flush with no space, that is a positive Shamroth sign. It indicates the nail angle has increased beyond normal range. Do this test right now. The finding warrants a medical consultation. Urgency level: act today. New or progressive clubbing in an adult over 60 with no prior diagnosis warrants same-week evaluation. Photograph the finding and call your physician. Signal number 2, the spoon nail, and when iron runs out quietly. Now look at the nail from above with good light. A healthy nail has a smooth, slightly convex surface, like the back of a spoon. What I want you to look for is the opposite: a concavity. A dip in the center of the nail plate, as if someone gently pressed a thumb into soft clay and left an indentation. In some cases, the edges of the nail actually curl upward around the depression. If you placed a small drop of water on the nail surface, it would stay there rather than rolling off. This finding is called koilonychia. The mechanism is direct and well understood. Iron is a critical structural component in keratin synthesis. It participates in the enzymatic reactions that link keratin fibers together during nail formation. When iron levels fall, those bonds form incompletely. The keratin matrix loses its internal rigidity. Instead of maintaining an outward arch, the plate softens and the natural pressure of the fingertip pushes it inward into a concave shape. Here is the finding that surprises most people. Spoon nails can appear before iron deficiency shows up definitively on a standard blood panel. The body prioritizes maintaining hemoglobin levels above all other iron-dependent processes. It sacrifices peripheral tissue synthesis first. Your fingernails deplete before your red blood cells do. The nail is ahead of the laboratory report by weeks. A 2019 study in JAMA Dermatology found Koilonychia present in 38% of confirmed iron deficiency anemia cases, and critically, in 14% of patients with depleted iron stores but still normal hemoglobin levels. The authors identified spoon nailing as the earliest peripheral structural sign of iron depletion, preceding laboratory-confirmed anemia in a clinically meaningful proportion of patients. Urgency level, monitor. Request a complete iron panel at your next appointment. Not just hemoglobin, but serum ferritin, serum iron, and TIBC. Ferritin is the most sensitive early marker of iron depletion. Photograph the nail and bring the image to your physician. Signal number 3. The horizontal groove, your body's crisis calendar. Hold your hand under a strong light. Natural daylight is best. And look across the surface of the nail from base to tip. You are looking for a horizontal groove, not a line running lengthwise from base to tip. That is different. What I want you to find is a furrow running the other direction, from one side edge of the nail to the other, cutting across the full width of the plate like a shallow trench. These grooves are called Beau's lines, after the French physician Joseph-Honoré Simon Beau, who documented them in 1846. Each one marks a precise moment when your nail matrix temporarily stopped producing keratin. The matrix suspends activity only under significant physiological stress, high fever illness, major surgery, chemotherapy, severe psychological trauma, acute nutritional crisis. When the crisis passed, growth resumed, but the pause left a permanent structural record in the plate. And here's the part that makes Beau's lines genuinely remarkable. You can calculate when the event occurred. Nails grow at a relatively consistent rate of 3 to 4 millimeters per month. Measure the distance in millimeters from the groove to the edge of your cuticle. Divide that number by 3. The result is the approximate number of months ago that your body experienced that crisis. A groove sitting 8 millimeters from the cuticle happened roughly 2.5 months ago. One groove, one event. Multiple parallel grooves mean the body faced repeated systemic stress. Grooves appearing simultaneously across all 10 fingers, not just 1 or 2, indicate a whole-body physiological event rather than a localized process. Single groove with a known cause. Observe. Multiple grooves, monitor, and discuss. All 10 fingers with no identified cause. Act today. Signal number 4, color shifts. The spectrum your doctor never looks at. Beneath your nail plate runs a network of capillaries threaded through the nail bed. A healthy nail is pink because oxygenated blood is flowing through those vessels at normal volume and concentration. That pink is not cosmetic. It is a live readout of your circulatory and metabolic state. Yellow nails, the most common color complaint in patients over 60. First cause is onychomycosis, fungal infection. Organisms penetrate the free edge, degrade the keratin, and produce characteristic yellow discoloration with thickening and crumbling. In any adult with elevated blood glucose, whether diagnosed or not, a fungal infection with any skin break is a pathway to bacterial invasion that can progress to limb-threatening infection. This is not a cosmetic problem. White nails, not white spots, but the entire plate turning opaque and milky with no pink showing through, are called Terry's nails. When the liver is under sustained stress, the vascularity of the nail bed diminishes. The pink disappears. Terry's nails are recognized in clinical hepatology as one of the early peripheral signs of hepatic dysfunction, appearing before jaundice and before the patient feels anything definitive. Blue or gray discoloration across the nail plate means the hemoglobin in those capillary beds is carrying less oxygen than it should. The conditions that produce this include chronic obstructive pulmonary disease, severe asthma, structural cardiac abnormalities, and certain cardiac medications. If you are on an antiarrhythmic medication and you notice your nails developing a bluish tint, that is a conversation to have with your prescriber before your next scheduled visit. Now, the finding I need you to pay the most careful attention to. A dark longitudinal stripe, a narrow line in brown or black running from the base of the nail toward the tip. In adults with darker skin tones, this can be entirely normal, but there is a form of melanoma that develops specifically beneath the nail plate. acral lentiginous melanoma, that presents as exactly this kind of stripe in its early stages. A 2020 review in the Lancet Oncology found that subungual melanoma carries a 5-year survival rate ranging from 16 to 80%, depending entirely on stage at diagnosis. The median delay from first patient observation of a dark nail streak to confirmed diagnosis was 18 months. The mandatory referral criteria: stripe width exceeding 3 millimeters, irregular or blurred edges, non-uniform coloration within the stripe, and pigment extending beyond the nail plate onto the surrounding skin. Urgency level for dark stripe with any of those features: act today, photograph with a ruler for scale, and contact a dermatologist. Not your primary care physician's next available appointment. A dermatologist. Today. Signal number 5. The disappearing moon. What your lunula is telling you. Look at the base of your thumbnail. You should see a white crescent, a pale half-moon shape where the nail meets the cuticle. That crescent is called the lunula. It is the only portion of the nail matrix visible through the plate, and its size, color, and presence carry specific diagnostic information. In a healthy adult, the lunula is clearly visible on both thumbs and faintly present on the index fingers. If it has disappeared entirely from all your fingers, if you look at your thumbs and see no white crescent at all, that finding is associated with anemia, nutritional depletion, or hypothyroidism. A sluggish thyroid slows metabolic activity in every cell, including the matrix. When matrix activity is suppressed, the growth zone recedes deeper under the cuticle, and the lunula shrinks or disappears. The opposite finding is equally informative. If your lunula occupies more than 1/3 of the total nail plate, large, pronounced, extending well into the middle of the nail, that is associated with hyperthyroidism. The matrix produces keratin faster, the growth zone pushes outward, and the lunula becomes disproportionately large. And a finding that is rare but serious: a blue lunula. Not the plate, just the crescent. A bluish tinge to the lunula is one of the peripheral signs of Wilson's disease, a hereditary disorder of copper metabolism, in which excess copper accumulates in the liver and brain. Without treatment, Wilson's disease causes progressive liver and neurological damage. It is diagnosable, it is treatable, and the lunula occasionally signals it years before the damage becomes irreversible. Absent lunula. Monitor, request thyroid panel and blood count. Enlarged lunula. Monitor, request thyroid evaluation. Blue lunula. Act today. Copper metabolism testing required. Signal number 6. The surface and the perimeter. The signal most people walk past. Run the pad of your opposite index finger slowly across the surface of each nail. You are not looking, you are feeling. Longitudinal ridges running from base to tip are in most cases a normal consequence of aging. The matrix becomes slightly less consistent in its output as the decades accumulate. If these ridges have been present for years and are not dramatically worsening, observe and move on. But if the ridges appear suddenly over a period of months, or if you find small pits on the nail surface, tiny puncture-like indentations as if someone pressed a pin into the keratin repeatedly, that is a different signal entirely. Multiple nail pitting across several fingers is one of the earliest and most specific signs of psoriasis. The pits appear because the matrix shares the same type of rapidly dividing cells as psoriatic skin plaques. The nail can show pitting years before any visible skin involvement appears anywhere else on the body. Your immune system is announcing itself at your fingertip before it has made itself visible anywhere else. Now look at the skin surrounding the nail. The fold of tissue at the nail's base and sides. Chronic redness, persistent swelling, or tenderness in this area that does not resolve over weeks is not a minor manicure issue. In rheumatology, nail fold changes, particularly the appearance of dilated, distorted capillary loops at the nail base, are one of the earliest detectable signs of systemic autoimmune disease. Conditions including scleroderma, lupus, and dermatomyositis produce characteristic capillary changes in the nail fold before any joint, organ, or skin involvement has appeared. The nail fold is a transparent window into the microvascular system. Self-test. Capillary refill. Press firmly on the nail plate of your index finger until it blanches white. Release and count. Pink color should return within 2 seconds. If it takes longer, blood flow to that fingertip is impaired. This test is used routinely by emergency responders to assess peripheral circulation. Under 2 seconds, normal. 2 seconds or longer. Discuss peripheral arterial flow with your physician. Now I want to give you the system. Not a list of things to memorize and forget. A repeatable 3-category examination, under 5 minutes once a month, that turns everything we covered into a structured, documentable habit. See it, test it, act on it. Category 1. See it. Remove all nail polish completely at least once a month. Use natural daylight. Standard household bulbs distort color. Look at color first. Pink and even, normal. Yellow with thickening or crumbling. Photograph and assess for fungal infection or systemic cause. Blue-gray, oxygen evaluation. White opaque full plate, hepatic evaluation. Dark longitudinal stripe with any warning features. Dermatologist today. Look at shape second. Domed nail or thickened fingertip. Shamroth test immediately. Concave nail. Iron panel at next appointment. Nail lifting at the tip. Thyroid evaluation plus medication review. Look at lunula third. Visible on both thumbs. Normal. Absent on all fingers. Thyroid and blood panel. Enlarged beyond 1/3 of plate. Thyroid evaluation. Blue tint to lunula. Copper testing today. Photograph every finding. Date every photograph. Category 2. Test it. Shamroth window test every month. Press same finger from both hands together nail to nail. Diamond gap present? Normal. Gap absent? Medical evaluation. Capillary refill test on index finger. Blanch and release. Under 2 seconds. Normal. 2 seconds or more. Discuss with your physician. Category 3. Act on it. Observe, photograph, and return next month. Compare. If the finding has changed, reclassify it. Monitor. Bring your photographs to your next scheduled appointment. Do not describe. Show the image. Ask specifically for the relevant test. Do not leave without a specific test ordered or a specific reason it was not needed. Act today. Call your physician's office this week. For a dark longitudinal stripe with warning features, call a dermatologist directly. For a positive Shamroth sign with no prior diagnosis, mention the word clubbing explicitly. It will communicate the clinical significance immediately. Dorothy came back to see me 14 months after her surgery. Her nails had returned to a normal, gently arched contour. The clubbing had resolved. She told me she had started looking at her hands every morning, that she had taken photographs of her mother's nails at Thanksgiving and found Beau's lines she wanted me to look at. She had become her own first line of examination. That is exactly what this is designed to do. The instrument is free. It is on your hands right now. It does not require a lab order, a copay, or a 6-week wait for an appointment. It requires only the knowledge of what to look for and the habit of actually looking. Before you move on, I want to hear from you. Look at your hands right now. Run both self-tests. Then come to the comments and tell me what you found. One finding, however minor it seems. Tell me what it looks like and how long it has been there. And tell me your age, because the prevalence of each of these 6 signals shifts measurably across the decades after 60. And knowing who is in this audience allows me to weight the next video toward what is most relevant for exactly where you are. If you found something today that you had never noticed before, or something you had noticed and dismissed for years, share it. You may be doing the same thing for someone reading the comments that Dorothy's story did for me. If this gave you a framework you intend to use, subscribe, because what I am covering next, on the skin changes after 60 that carry the same diagnostic weight as nail findings, and on the specific blood markers that your annual physical almost certainly does not include but should, all of it is built on the same principle. Your body is reporting. We need to learn to read. There is one more thing before you go. Every signal we cover today lives on the nail plate, a structure made of dead keratin, recording what happened in the matrix months ago. But there is a second surface on your body that carries real-time information. Changes happening in the underlying tissue right now, not 6 months ago. It is the skin of your hands, forearms, and face. And after 60, it produces 6 specific changes that carry the same diagnostic weight as everything I showed you today. One of those changes is something most Americans interpret as a cosmetic issue, a harmless consequence of sun and age. Research published in the Journal of Investigative Dermatology shows it is something considerably more specific than that. It is on your screen right now. Watch it next. I will see you there.